Hi, my name is Alexandria Lizza, and I am a 22-year-old online MBA candidate at the University of South Florida. My background is I completed my undergraduate degree in health sciences in December of 2021, and then the following semester started this program, so I have no prior experience working in a corporate environment. But I chose the topic, how has the COVID-19 pandemic aided in the integration of telehealth medicine into the U.S. healthcare system, and what are the implications? Because I will be entering the medical sales industry this upcoming August, and telehealth programs are a new product that has, with the help of COVID, radically transformed the way in which providers access and treat patients. And while I'm particularly interested in telemedicine, its impact on our healthcare system will affect us all. The ways in which we receive care have greatly expanded, and with telemedicine, anyone can receive medical attention from anywhere they can find internet connection or phone service. The COVID-19 pandemic made in-person visits nearly impossible. When the world went into lockdown, citizens were instructed to stay in home and limit contact. Healthcare facilities across the U.S. were faced with an unparalleled influx of patients in critical conditions. However, telemedicine allowed for the continuity of care for patients with pre-existing conditions and chronic illnesses. It helped provide minimal wait times and streamline care practices. It also minimized the number of patients coming in for medical attention into healthcare facilities. Telemedicine also allowed for the coordination of care, so providers were able to share information as it became available and collaborate on treating COVID-19 patients. It helped providers communicate more readily with one another and discuss ways in which they can improve their treatment plans. It also helped with the relocation of funding towards COVID-19 relief efforts, medical equipment, and supplies. Not only did it help combat the pandemic, but it really allowed for the continuation of care for all diseases and illnesses. Telemedicine has given patients the opportunity to receive medical attention from virtually any location. The ability to meet with a provider from anywhere has increased access to care in many locations. Well, specifically, in rural areas with limited access to healthcare facilities, telemedicine has allowed patients to receive medical attention with greater ease and convenience. Patient satisfaction has reflected these outcomes. A recent study conducted in 2022 by J.D. Power found that 57% of patients preferred telehealth to in-person services. Healthcare professionals were tasked with learning and adopting telehealth services into their practices. Many healthcare professionals felt burdened by the technological barriers. Physicians were unable to conduct physical exams and perform other diagnostic testing procedures. Without these tests, physicians were not as confident in their diagnosis, and professionals also expressed that these virtual services hindered their overall sense of personal connection. They felt that their relationships with their patients suffered without body language and nonverbal cues. This was especially burdensome within the mental health sector, which relies on such cues to make proper assessments and diagnoses. When our healthcare system was on the brink of collapse, telemedicine was the solution health service organizations needed. Telemedicine allowed healthcare facilities to concentrate their efforts on COVID-19. They were able to manage the influx of patients by offering telemedicine appointments for medical consultations, prescription refills, mental health counseling, and chronic disease management. While telemedicine was a necessity during the pandemic, hospital systems must now determine how they wish to proceed with telehealth services. Telemedicine can offer alternatives for emergency visits and therefore decrease the number of patients who seek emergency services. With fewer patients, facilities can function at a greater operational efficiency, and better efficiency leads to shorter hospital stays and lowered readmission rates. Not to mention, the longer a patient is in a facility, the greater the risk of contracting a hospital-acquired infection, an outcome that would certainly require more resources to treat and a greater length of stay. However, cybersecurity threats are a major issue that hospitals must address. Ransomware attacks are a real threat to the functionality of a healthcare system. A recent study conducted by Panam Institute reported that nearly 60% of facilities were met with higher mortality rates following a cyber attack. During the pandemic, many insurers and payers extended coverage and reimbursements to include telehealth visits. Policies were modified to include remote medical consultations, mental health appointments, remote monitoring, and other services. Most notably, the Centers for Medicare and Medicaid amended policy coverage to include both video and audio-only health appointments. Before COVID, only some states allowed physicians to deliver telehealth services. However, in May 2020, all 50 states and the District of Columbia amended these regulations. U.S. health insurers should be concerned about potential cyber hacks within telehealth programs, for several reasons. Insurers are responsible for protecting patients' data. If there is a data breach, insurers risk exposing private information to unauthorized individuals. Other repercussions include financial penalties, legal consequences, reputational damage, and harm to their customer base. Insurance companies must have policies in place to address the handling of data breaches. They should obtain patient consent forms for data sharing that comply with HIPAA and other privacy regulations. Besides patient privacy, insurers should also establish a precedent for the quality of care. Insurers are ethically responsible for approving the credentials and certifications of telehealth services. From this assignment, I learned how technology can revolutionize an entire industry. Looking at the healthcare industry from a business standpoint, I was able to assess the benefits and potential risks involved with any new technology. I first realized that innovative technology should have a purpose and a business model. Prior to COVID-19, telehealth was a part of our healthcare system on a much smaller scale. Healthcare facilities did not need to invest heavily in remote patient record keeping, video communication platforms, and the training involved. However, once COVID-19 protocols went into place, the need for an alternative care delivery method became essential. Given the life or death circumstances, facilities had little time to find a solution and quickly determined telehealth services could be the answer. For businesses in general, however, adverse circumstances and other potential issues should be anticipated. Before implementing new technology, businesses should heavily weigh its pros and cons. There should also be sufficient testing done to support each potential benefit. Besides assessing the technology itself, it is as important to determine how it will affect employees and customers. As seen with patients and healthcare professionals, not everyone will come out in support of a new technology. New technology breeds skepticism. Executives should consider the impact on the company's reputation. Will their customers appreciate the inclusion of new technology or find it distrusting? It is in the best interest of any company to ensure these concerns are addressed properly to gain its users' trust. Users' opinions should be considered when determining if integrating new technology is favorable. Finally, new technology should be considered if it will improve the operational efficiency of a business. If the addition of a new technology will allow employees more time to handle more complex tasks or complete tasks with greater efficiency, a company should consider this technology. If these benefits exist but incorporating the technology will be a costly investment, then executives should investigate further. There is no simple answer when it comes to acquiring innovative technology into a business model. There are a plethora of factors that must be considered.